Hello, my name is Dr. Dewan S. Raja. Today I will discuss about osteoporosis and the drugs used to treat osteoporosis. What is osteoporosis? Osteoporosis is a severe form of osteopenia with decreased bone mass, at least 2.5 standard deviations below mean peak bone mass, with an increased risk of bone fracture. What are the causes of osteoporosis? Senility. So it may happen both in female as well as in the male, but it is mostly in the female. Menopause. Once the menopause has started, then after the menopause, that is the postmenopausal period, is the time a lot of women faces osteoporosis. Endocrine disorder, many endocrine disorder, maybe hyperthyroidism, hypothyroidism, Addison's disease, pituitary tumor, like this. Endocrine disorder may lead to osteoporosis. Malnutrition. Due to malnutrition, calcium, vitamin D, and vitamin D may not be absorbed. Some drug cause osteoporosis, like corticosteroid, like the glucocorticoid, anticoagulant, like heparin, anti-cancer drug, any anti-cancer drug may lead to osteoporosis. Anticonvulsant, the drug used to treat the epilepsy, like phenytoin, carbamazepine, they may also lead to osteoporosis. And alcohol, it may also cause to a certain extent osteoporosis. Lack of physical activity. Genetics, important factor, genetics. Idiopathic, unknown cause. So these are the possible causes. Even lack of exposure to sunlight may decrease the vitamin D in the body, and that may lead to lack of calcium absorption and osteoporosis. Management of osteoporosis includes weight-bearing exercise, calcium and vitamin-rich diet, hormone replacement if it is needed, like Addison's disease, hypothyroidism. Drugs, and also you can use some drug as a medication to treat osteoporosis, and certainly monitoring the bone density periodically. So that is the management of osteoporosis. Now we'll discuss the drug that is used to treat osteoporosis. We have many drugs like that of bisphosphonate, teriparatide, selective estrogen receptor modulator, calcitonin, and rank ligand inhibitor. First of all, bisphosphonate, this is very commonly used to manage osteoporosis. These are analog of pyrophosphate, that is alendronate, risedronate, etidronate, and pamidronate, that are used to treat bone remodeling disorder such as osteoporosis. Paget's disease of bone, not the Paget's disease of the breast. Paget's disease of the bone, also called osteogenesis imperfecta, and metastatic bone cancer, we can manage by bisphosphonate. Bisphosphonate inhibit osteoclastic activity. Osteoclast cells are present in the bone, especially on the surface of the bone, and these are large cells, we can call it giant cells, often multinucleated, and this cells has the capacity to resorb the bone So if we can inhibit this bone, then bone will remain, it will not be it will not be resorbed. Okay, so the bisphosphonate act by inhibiting osteoclastic activity. Adverse effects of bisphosphonate include diarrhea, nausea, abdominal pain, esophageal ulcer, and we have some that is common, that is esophagitis. Any contraindication? Yes. Patients with impaired renal function should not take bisphosphonate. Patient has dysfunction of his kidney failure, should not take bisphosphonate. Okay, and idea is that patient should take the bisphosphonate in the early morning, empty stomach, and he should not lie down within half an hour. He should be ambulatory, maybe in sitting position, to avoid esophagitis, inflammation of the esophagus. Teriparatide, this is a recombinant segment of human parathyroid hormone. It is used, it is a recombinant segment of human parathyroid hormone used for the parenteral treatment of osteoporosis. That is given by injection, maybe intramuscular. It increases spinal, maybe intravenous, depending on the situation. It increases spinal bone density and it decreases the risk of vertebral fracture and stimulates bone formation. Teriparatide is also useful to manage glucocorticoid induced osteoporosis, like some people is taking prednisolone for a long time. They may have osteoporosis due to glucocorticoid action. So that in that case, teriparatide is a drug of choice. Okay, it is rapidly degraded in the liver and in the kidneys. The teriparatide. Then we'll go to the selective estrogen receptor modulator. That is the Raloxifene. Is one of the ACRM, that is selective estrogen receptor modulator, approved for the prevention and treatment of osteoporosis. Not only prevention, but also treatment. Okay, so this is used prevention and treatment. Okay, and treatment of osteoporosis. Okay, so we got that. Raloxifene decreases the risk of hip fracture, increases lipid profile. We need less cholesterol, we need more HDL, there is good cholesterol, less bad cholesterol like LDL, and we also like to decrease the triglyceride level. So this is helped by the Raloxifene. Raloxifene increases good lipid profile. It increases so that the person's vascular system, heart is protected, okay, due to lack of cholesterol. It increases bone density without increasing the risk of endometrial cancer. So this is good. The Raloxifene that will increase the bone density without increasing the risk of endometrial cancer. Calcitonin. Calcitonin is naturally present in our body. It is secreted from the parafollicular cells of the thyroid gland, and it actually, the calcitonin, this is the hormone, it places the calcium from the blood to the bone. So bone will be protected. Bone will not be lack of calcium. So calcium is more going to the bone from the blood by calcitonin. But this drug is administered intranasally. So there may be some nasal irritation that is very common complaint. It is effective in osteoporosis and is well tolerated by the postmenopausal women. Calcitonin decreases bone resorption, improves bone architecture, relieves pain, and increases function. But the problem is that it develops tolerance due to continual use. Then we'll get the rank ligand, RANKL inhibitor. Denosumab is human monoclonal antibody that binds to and prevent the action of RANKL, rank ligand inhibitor. It inhibits osteoclastic formation and activity. Can be used for the treatment of postmenopausal osteoporosis. So these are the drugs. This is most commonly used drug. One of the unexpected adverse effect is bone fracture in unsafe place, like in the middle of the shaft of the femur due to bisphosphonate. There is some report like that. It protects the bone, but sometimes it may behave differently. There may be fracture in an unusual site in the mid shaft of the femur. Okay, so we got the causes of osteoporosis. Some diseases may also cause osteoporosis, like multiple myeloma and type 1 diabetes. Okay, so we got bisphosphonate, commonly used drug, teriparatide, mostly commonly used. It is one of the commonly used drug. Okay, but this is the most common, bisphosphonate, and elandronate is most common. Okay, so it increases spinal bone density, decreases the risk of vertebral fracture, and stimulates bone formation. Calcitonin is administered intranasally. Okay, it is effective in osteoporosis and is well tolerated by the postmenopausal women. Regarding rank, there has role in the treatment of postmenopausal osteoporosis. Okay. Okay, and that's all about the osteoporosis and the drug used to treat osteoporosis, the pharmacology of osteoporosis prevention drugs. So if you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.